What is the role of current and scientific ergonomics in managing pain? A prevalent and often unhelpful belief among the general population, and sometimes even within healthcare, is that perfect static posture and rigid ergonomic adjustments are key to preventing or resolving musculoskeletal pain, especially spinal pain. This often leads to excessive focus on furniture settings, such as chair height and monitor position, and attempts to maintain an ideal seated or standing position throughout the day. However, current scientific evidence challenges this notion, suggesting that rigid ergonomic changes at work or home are not the primary drivers for managing or preventing most common musculoskeletal pain. Instead, emphasis should be placed on movement variability, activity, and a comprehensive understanding of pain, reserving detailed ergonomic interventions for specific high-risk occupational tasks involving heavy or sustained loads. Has the importance of ergonomics in preventing pain been overemphasized? 1. Limited efficacy for common spinal pain prevention. Systematic reviews on ergonomic interventions for office workers, for example, adjustable chairs or workstation redesign, show limited or low-quality evidence for preventing or significantly reducing the prevalence or intensity of low back and neck pain. Often, these interventions are no more effective than no intervention or minimal intervention. 2. Movement variability is better than static perfect posture. The concept of a single correct or neutral posture to be maintained rigidly is not supported by evidence for pain prevention. Research suggests that the human body thrives on movement variability and dynamic postural changes. Prolonged static postures, even good ones, can contribute to discomfort and stiffness. Encouraging frequent changes in position and regular movement breaks is more beneficial than striving for an unachievable static ideal. Finding what is comfortable is key. 3. Multifactorial nature of pain. Spinal pain and other musculoskeletal disorders are complex multifactorial conditions influenced by biological factors, for example inflammation, psychological factors, for example fear avoidance, and social factors, for example work satisfaction. Over-attributing pain solely to posture or workstation setup ignores these significant contributors and can perpetuate unhelpful beliefs or fear. And 4. Specific occupational context matters. Blue collar versus white collar. While general office ergonomics have limited impact on pain prevention for sedentary workers, ergonomic interventions are more critical and effective in preventing injuries in occupations involving high physical demands, such as repetitive heavy lifting, sustained awkward postures, or exposure to whole-body vibration, common in blue-collar settings. In these contexts, specific adjustments to tools, tasks, and environments are important for injury reduction. How to address ergonomic misconceptions. 1. Reframe the posture is key narrative. Educate patients that perfect posture is a myth for preventing or managing most musculoskeletal pain. Emphasize that the human body is robust and designed for movement, not for rigid static positions. Encourage the next posture is the best posture approach. 2. Prioritize movement and activity variability. Advise patients to regularly change positions, take frequent micro breaks, for instance, every 30 to 60 minutes, to stand, stretch, or walk, and integrate general physical activity into their day. This is more impactful than meticulously adjusting their chair or screen for hours on end. 3. Address the multidimensionality of pain. Broaden the conversation beyond physical factors to include psychological influences, such as stress and fear, social influences, for example, work demands or satisfaction, and lifestyle influences on pain. And 4. Contextualize ergonomics appropriately. For office workers, focus on simple comfort adjustments and movement. For patients in physically demanding jobs, collaborate with occupational health or ergonomic specialists to identify and mitigate specific high-risk physical exposures, such as lifting techniques or workstation design for heavy tasks. Differentiate clearly where formal ergonomic assessment is truly indicated. Let's put it in practice. Dr. Evans, physical therapist, is consulting with Maria, a 35-year-old office worker, about her back pain and concerns about her home office setup.
Maria, you're concerned your back pain is from your posture or home office. Many people think that. What have you tried with your setup?
I bought a lumbar support, tried sitting straight, and raised my monitor, but my back still aches. I feel like I'm always fighting to sit right.
I understand you're trying hard. What might surprise you is that constantly fighting for perfect posture isn't the main key for most back pain. Your body is designed for movement and variety, not rigid positions. Studies show that even with expensive ergonomic chairs, workers don't necessarily have less pain. How much you move throughout the day is far more important.
Really? So less focus on the chair, more on moving myself?
Exactly. Find a comfortable setup, but then prioritize getting up and moving often. Set an alarm to stand or stretch every 30 to 60 minutes. Even just shifting in your chair helps. Your pain is complex, influenced by stress, sleep, and overall activity, not just how you sit. My goal is to help you move freely and build resilience, rather than focusing on a rigid, correct way to sit.
That's a very different way of thinking.
Precisely. We'll work on building your strength and confidence with movement and integrating simple movement breaks into your day. This approach is much more powerful for long-term relief and overall health than meticulously adjusting every piece of furniture.
To sum up, it's crucial for healthcare professionals to reframe common misconceptions about ergonomics. By emphasizing movement variability and the multifactorial nature of pain, clinicians can empower patients to shift focus from static postures to active strategies. This approach, grounded in current evidence, promotes genuine resilience and more effective lasting pain management.